Welcome everyone. I'm Victoria Delgado from the Leiden University Medical Center, and I'm with Dr. Vanovic from the University of Belgrade, who presented today at the American Heart Association Scientific Sessions the study AVATAR trial. Dr. Vanovic, tell us what is the study about and what was the rationale for it.
Thank you, Dr. Delgado. So the rationale was it is unclear whether the early aortic valve replacement is beneficial in asymptomatic patients with severe aortic stenosis and normal left ventricular systolic function. So the purpose of the AVATAR trial was essentially to address this true clinical dilemma of evaluating the efficacy and safety of early aortic valve replacement in low-risk asymptomatic patients with severe but not critical aortic stenosis and with normal systolic function of the heart.
And what did you do in order to make sure these patients were asymptomatic? Because sometimes it's difficult. Tell us a little bit about the methodology of your study.
Yeah, okay, so we have included 157 patients, which were randomized to two groups, either aortic valve replacement or so-called watchful waiting strategy till symptom onset and then intervention. So in order to include truly asymptomatic patients, we have performed systematically the exercise testing in order to unmask potential symptoms. And also in order to be truly asymptomatic, to be sure that patients are asymptomatic, the patient needed to reach a certain heart frequency to be sure that he is really without any symptoms.
And what was the primary endpoint of your study?
The primary endpoint was a composite of all-cause death and the combination of unplanned heart failure hospitalization, acute myocardial infarction, and stroke.
And the results of the study, what did they show?
So the results have shown that the incidence of primary endpoint was significantly lower in patients who were randomized to early surgery. So this, let's say, clinically relevant composite endpoint was favoring early surgery in these asymptomatic patients.
So based on your study and another study that was published last year, these are the only two studies probably with a large population randomizing these sort of patients. What are your take-home message of the study? What do you think that the field will move forward in terms of treating patients with truly asymptomatic severe aortic stenosis? Do you foresee any change in guidelines in the future?
Yes, I see it. First of all, we have to be mindful that the totality of evidence needs to expand. So, but our data, which, as you pointed out, should be seen with a broader frame of previously published data, one randomized study, and the number of observational registry data. And all the published data points to the benefit of early aortic valve replacement. In clinical terms, that means that there is additional degree of evidence to physicians which are considering the potential treatment of these asymptomatic patients that the aortic valve replacement should or can be advocated to low-risk, truly asymptomatic patients with stenosis is severe and regardless of symptoms.
Perfect. So thank you very much, Dr. Vanovic, for sharing with us the study that you have presented at AHA this year. It's an important study because, as Dr. Vanovic said, there is still a lack of evidence, strong evidence to recommend the treatment for patients with truly asymptomatic severe aortic stenosis. And this study brings new data in order to decide in the future how we are going to treat these patients. Thank you very much for your attention.
Thank you also, Dr. Delgado. Thank you everyone.